Good morning, everyone, and welcome to today's webinar with Cornerstone, UnitedHealthcare, and Bind. I'm Nelson Culp with Cornerstone. Just a few housekeeping items to begin with. One, I know on your invite, it did say that this was for 2 hours. It's actually 1 hour, so I just wanted to get that out of the way. If you have any questions today, please type them in the question box, and we will answer the questions at the end of the presentation. Again, I'm Nelson Culp with Cornerstone, and I will be running this webinar today. For those of you, you can earn a $250 bonus through our Refer an Agent program. All you need to do is, if you know another agent who might also benefit from our services, with our Refer an Agent program, you can refer an individual and employee benefit market segment agents to Cornerstone, and we'll pay you $250 when they place their first paid application. It's as easy as 1, 2, 3. Also, you can earn up to $700 if you have not already registered with our cash incentive program. Please do so. At the top, you can see how you can register online at www.cornerstone.com/cash incentive program. For all group and individual new business sales between January 1st, 2021 and December 31st, 2021, you'll earn points that will bring you closer to a $7,000 cash prize. Top 15 qualifiers will earn cash with qualification starting at 2,000 points. Now, I would like to introduce our two presenters. We have Christian Botts. He's a 51-plus account executive with UnitedHealthcare working with Cornerstone. He has spent his entire 16-year career in the employee benefit industries as a sales consultant for both ancillary and healthcare companies. He's been with UnitedHealthcare going on 3 years and is based out of the Cincinnati office. Also joining us will be Pat Sukum. Is a member of the Bind Sales and Account Partnership Team, a co-founder of both Definity Health and Red Brick Health. Pat brings to Bind more than 20 years of healthcare innovation experience. With his broad background in health strategy, sales and marketing, account management, and underwriting, Pat has developed a focus on making meaningful changes to health insurance as the best way to promote improved health in people. And with that, I'm going to hand it over to Christian.
Okay. Well, good morning, everyone. Appreciate your time this morning. As Nelson mentioned, my name is Christian Botts. I'm a 51-plus account executive. I cover Cincinnati and the Dayton area and also the Columbus market. And we're going to talk with you this morning about a new product offering that we have a strategic partnership aligned with Bind. It is a really new and innovative product that you'll see as Pat's going to go through and demo. It's really a game changer and disruptor out in the marketplace. As you think about healthcare, and it's confusing and it's expensive. There are huge discrepancies in price across the board, and Bind really helps to, when you get down to it, it just helps simplify healthcare. And you'll see that just kind of really dumbing it down and getting members to take ownership of their healthcare, but giving them options at the same time. So you'll see Pat go through the demo here. It is such a cool product. Again, we have a strategic partnership with Bind, and it's really taken off and it's gaining more and more momentum. It is for clients on a self-funded basis with 125 enrolled, and we are getting to roll out in the state of Ohio fully insured for 51-plus clients. So really exciting offering. As I mentioned, we've been having really good success with it. And as I said, it's really a disruptor in the marketplace for a very good reason. and as Pat's going to illustrate. So I'll shut up there. I'm going to turn it over to the man of the hour, Pat Sukum with Bind. And as Nelson mentioned, any questions that you have, feel free to shoot them in the chat box, and we'll address them along the way. So Pat, I'll turn it over to you.
Great, thanks Christian, and Nelson, thanks for that introduction. I don't think I've heard actually my full bio in a while, so that was pretty entertaining for me. I appreciate it. Jumping right in, yep, I'm Pat Sukum. I'm with Bind. Hopefully everyone is seeing my screen here. And just as a background, Bind is headquartered out of the Twin Cities, so I'm actually out of Minneapolis as well. The company got started in the summer of 2016. I've been there pretty much since the start, so I've been there almost about 5 years. And I'm excited to show you Bind today. You know, when we think about Bind, we like to say it's safe to say this is the most excitement ever created by actuarial scientists and insurance experts, right? So we have a little playful fun there, but this actually does speak to who Bind is, right? Most of our team are data scientists, technology, and really what we're doing is we're taking all this data that exists in healthcare. Think about the billions and billions of pieces of claims information, and we're taking it apart to really start to create an experience for the end user that really allows them to make better decisions with their healthcare, higher value decisions, and how I like to refer to it a lot is to shop for their care, to really start to shop for healthcare. Now, with that said, and clearly we all have a little bit of a healthcare background, we know it's not quite that easy to shop in healthcare as is. And one of the big problems that we've identified that I think most of us see is that in the market, healthcare costs have a huge variation, driven by what you get done, where you go, and who you see. So driven by the treatments, providers, and locations. Right, the example I like to give is here in the Twin Cities, here in Minneapolis, you can go one location to get an MRI, and it can cost 3 times as much at another location. Right, this is common in markets across the country. We all see it, sort of this huge variation that exists. And if you think about healthcare and how there's not a lot of differentiation in healthcare, that huge variation typically represents waste. Right? You just don't see a lot of industries that have this huge variation. So first of all, there's huge variation in the market. Second of all, due to a lack of transparency, members have no insight into this variation. Right? So if you think about how we're getting care today, it's pretty random, right? I mean, you go and you get care and you don't know quality, you don't know price. And so again, due to a lack of transparency, members have no insight into this variation. And then ultimately, when a member does get low value care, whether it's randomly or intentionally, their employer also pays more, right? So it's really this idea that when an individual chooses expensive or higher or lower value care, everybody pays more. And so if you think about it for self-funded employers, so Bind works with self-funded employers, that's absolutely true, right? A member pays more, their employer pays more. But also for fully insured, right? And Christian and the team will speak more to that. We're rolling out into fully insured in Ohio as well. You know, it's gonna come around in higher initial quotes or higher renewals, right? So again, huge variation in the market. Nobody knows what this variation is, but when a member pays more for their care, everybody pays more. So that's really why we started Bind, to give additional information to help people make higher value decisions. But if I even take it a one step higher, the real reason we started Bind, which is probably something every one of you hears, is to control costs and to keep satisfaction high. Right, so high level results, you know, we actually had a study done by Milliman lately, the large national actuarial firm. And they looked at our book of business clients. So currently Bind has a little over 50 clients, a little over 125,000 members. And so Milliman looked at our historical book of business clients, and they saw that we are reducing the cost for our employers by 14% compared to traditional managed care. Now, this is looking at our full replaced clients, so there's no risk selection in there. It's also risk adjusted for things like disease burden, geography, demographics, but we are showing a 14% savings. What we're thrilled to see is we're also doing this by reducing employee out-of-pocket costs. So average employee out-of-pocket cost is dropping by up to 50%, right? So we're saving dollars for the employer, but we're not doing it by shifting costs to the employee. And this is further reinforced because we are seeing happier employees, right? Almost 3 out of 4 Bind members prefer the Bind plan to the plan they had prior, right? And if you look at the ring there, you see that 16% are neutral. So if you add those two numbers together, that's 90%, and 90% are showing satisfaction with Bind. So getting past some of the results, what is Bind? Right? So just to make sure we're all on the same page, we're all talking about the same thing today. First and foremost, Bind is a full service health plan, right? We process medical and RX claims. We are the TPA. So Bind is their own TPA. We provide customer service, account management. You're going to get reporting from Bind. I'm going to spend a little bit of time again talking about that data and the technology that's sort of the underpinning of Bind. That's all through us. We even have our own care management programs. Right, so you think about diabetes reversal or maternity, you're going to get through that through Bind as well. Again, we are your full service health plan. As Christian spoke to, we also have a strategic partnership with United. Right, we are separate carriers, separate companies, but United is an investor in Bind, and through that strategic partnership, we have access to a few things. So first of all, data. Right, so again, I talked about billions and billions of pieces of claims information. Well, that's coming through United as well as other sources that Bind has access to. But we're able to use that data to create the pricing algorithms we're talking about. The second thing we have through the partnership is we distribute through United. Right, so again, when you have interested clients and prospects, you're going to reach out to Christian and Rick and their team, and they're able to pull in Bind. And then last, we have access to the United Choice Plus network nationwide. So when you think about the provider network behind Bind, it's United Choice Plus, right? Contracted with physicians, broad access, deep discounts, again, access across the entire country. Okay. Lastly, for what is Bind, we're a better experience. So again, I talked about all that data and bringing tools and information to help the members make better decisions. Well, ultimately, it has to be a very easy to use experience, very intuitive, almost familiar, right? So you can see there, I'm showing you our app, right? Our smartphone app. We love our app, right? It's our baby. We love to show it off whenever we get a chance. We want healthcare to be very mobile. Right? Take it with you to the doctor's office if you have questions, or take it to the pharmacy if you want to look up pricing on the spot. With that said, I always like to point out that in addition to the app, and we get high engagement in the app, it's actually in the high 70% across a wide range of industries. We also have a regular website as well as a very robust customer call center. So when you're working with your clients and prospects, there's always going to be employees that want to give somebody a call, speak with a live person, get their questions answered. They can do that as well, right? Everything I'm going to show you on the app, individuals can also do when they give us a call. Okay, so let's jump into how Bind works, right? How do we generate that savings that I showed up front? Well, there's that app again, and the real power of the app is in that search toolbar at the top of the page, right? You can search for providers, drugs, treatments, conditions, right? If you think about an individual could type in a doctor's name, they could type in a drug name, they could even type in a condition, and use very simple language, right? They could type in runny nose or having a baby or sore throat, right? And if they typed in sore throat, the site's going to say, yep, a sore throat is covered, just like you would expect it would be, right? Bind is going to cover everything that your clients and prospects are covering today. Right? We're not a skinny plan, we're not a mech plan or anything. We're comprehensive care. We're going to cover what they're covering today. But you're going to see also that we're going to show you different ways you can treat a sore throat and the price associated by following that path. Right? So an individual might say, I was going to run to urgent care, but when I see this menu of items, I see I have other options at different prices. Right? So they might say, actually, I'm going to do a virtual visit. right? That's the online chat with a provider. They can still prescribe you drugs. We all have seen a virtual chat. But yeah, the member might say, great, I can save some money, but it's also more convenient. It'll save me some time. And they're making a higher value decision, right? And as I said earlier, when a member makes a higher value decision, everybody saves, right? You reduce costs for the plan, you reduce costs for the self-funded employer. Now, we use Doctor on Demand for our virtual visits. Our virtual visit provider is Doctor on Demand. That's who we partner with. We recently had a call with Doctor on Demand where they told us they're seeing 3 times the use of virtual care with Bind than compared to their other traditional managed care partners, right? So we are seeing people make those higher value decisions. Now, everything in Bind, you're seeing these prices, everything in Bind has a price. So you're gonna search whatever provider, drug, or condition you wanna look up, and you're gonna see a price. Again, we have priced everything. Now, when I keep saying prices, and another way to think of them is as copays, right? Now, we think of them kind of as souped up copays because they can change over time, or there's a range of them within some categories. We actually call them smart copays or smart prices. But that's a good way to think of them in the sense that you have an employee portion and an employer portion for every service you engage in, right? So when I say everything as a price, I'm also saying everything as a copay. And when I say everything as a copay, it also means we've gotten rid of deductibles and coinsurance. So we've taken those mechanisms, deductibles and coinsurance, and we've completely pulled them out of the plan. You're not going to see them anywhere in the plan. And we've got rid of them for a few reasons, right? If you think about a deductible, first of all, it's just kind of confusing, right? People don't know where they're at under a deductible. They don't know how far they have to go. And if they do get into coinsurance, then it's sort of a complex level of math that no one can do anyway. So that's why we've gotten rid of those. Another reason is a deductible can actually act as a threshold, right? You don't get any help from the plan until you hit that deductible. And unfortunately, we see people avoiding care because of it, right? So we wanted to get away from that idea and go to copays where you're getting help along the way, but we're also able to show you prices. Now, we've also hung on to things that are familiar within the plan, right? There are things that people have now that bring them peace of mind, like an out-of-pocket maximum, and we still have that in the plan, right? So all your prices, all your copays are still gonna build to an out-of-pocket max. You don't have to worry it's gonna sort of be indefinite for those individuals that have sort of hard healthcare years. There's still an out-of-pocket maximum. Now, taking this example a step further, let's say you said, you know what, I wanna choose an office visit. So you clicked on that tab, and what it's going to show you are, frankly, different providers you can go to and the different upfront costs to go see them. So now that your employees or the member sees the actual cost to go and see that provider, right? And again, you can see we're using the price points to help nudge individuals to higher value care. Now, again, earlier I talked about the billions of pieces of claims information that we're using to create these algorithms. Well, they're based on both cost and quality, right? So when we look at all the providers with all this claims information, we can start to say, yep, there's different unit costs, there's different price components that are being applied, but we can also start to look at quality, both in the terms of outcomes, treatment paths, alternative paths, things like that, and we can incorporate that into the pricing components to help nudge as well. So when I talk about higher value, we want to make sure we're talking about both cost and quality, and that's incorporated in the pricing. If I was to click on one of these docs, you're going to see additional information, right? Stuff you would expect to see, like where they're located, that they're in network. But again, some of the additional information Bind's going to provide, like the all-inclusive price, right? There it is, $25. I say all-inclusive because it does include basic labs and x-rays, right? So if you were to get some blood work done, that's going to be included in your $25, right? We want to make sure we're avoiding surprise billing as much as possible, right? We want individuals to know their upfront price. We're even also going to tell you if that price is going to change, right? So as you can imagine, prices change in healthcare, just like prices change in any industry. In healthcare, we just don't know it, right? There's no transparency, so nobody even knows what the price is, much less that it's changing. So we're gonna let you know if next quarter the price is going up or down. We wanna make sure you understand that. Through our partnership with United, we also have access to some additional information, like whether or not the provider is accepting patients, and even United's premium designation program. So you're probably familiar with this. This is their actual rating of physicians, and we're able to show that information as well. Rating of physicians on quality, excuse me. So again, we want to show price and quality where available as much as possible as well. Now, something I want to point out here is, we're showing a lot of information. We're showing the app. The app isn't meant to be a barrier to receiving care, right? Really, we're just showing members and employees additional information to help them make their decision, right? A member still chooses to go wherever they want to go. This isn't to limit their choice. They're just now seeing additional information, right? Now they can make higher value decisions, find ways to save themselves money. I mean, I even like to point out that, every employer is going to have some employees that say, you know what, I never want to use the app. I never want to go into the app. I never want to give you a call. I'm just going to go get care. They can still do that, right? We're going to still send out ID cards. They can use their ID card. They can take it to the hospital and get care still. And they're going to get a bill. It's going to come, weeks or months later, and it's going to be for $25, right? So you can use the plan however you want. You can use it the same as how you use it today. We just want to provide these options and alternatives so people can frankly make higher value decisions, save money for themselves, save money for their employer or the plan. Now, what I just showed across office visits, we do this across a number of categories. I'm showing a few more of the prominent ones here. Like I said at the very beginning, MRIs, right? Huge cost depending on where you go. We want to show you what that range could be. Same with having a baby. Even things like prescription drugs, right? You might say, yep, I'm going to Walgreens, or I shop at Walgreens, and you might say that's $20 a month. But wait, I could go across the street to this Costco, and it's going to be $5. Right? Maybe I already shopped there. Now I can save $15 a month, right? That's a really easy change. Now, again, someone might say, you know what? I love Walgreens. I'm a huge Walgreens fan. I'm always shopping at Walgreens. Well, they can still do that, right? The choice is theirs. They're just going to pay more to shop at Walgreens. And the truth is, under most current plans today, they're paying more to go to Walgreens anyway, right? Either they as a member are paying more, or their employer or the plan is paying more. We're just giving you more transparency, more clarity to help you make those decisions. Now, something I'll throw out here real quick, and Rick or Christian might speak to it more, but when we're speaking to prescription drugs, the PBM we use, the pharmacy benefit manager, is Navitus. So Navitus is Bind's PBM. Navitus is, we like them because they're fully integrated into our site, right? Again, you can see how they're going to drive you to higher value drugs. But also Navitus doesn't play the spread pricing game. They don't collect rebates. So for our self-funded clients, you're going to get 100% pass-through rebates back to the employer. Okay. And I want to show you an additional feature that Bind has, right? And this feature actually allows members to create even more savings and actually generates substantial savings for the plan or the employer. And we call it Bind on Demand. So everything I've showed so far is Bind Basic, right? Everything's a copay, right? Everything I showed is a copay, everything has a price, that's Bind Basic. For Bind on Demand, we've created an opportunity by identifying 45 45 uncommon plannable procedures, right? In Basic, they're included as well. But with Bind on Demand, we've identified these 45 procedures because there's large variation depending on where you go to get the treatment done, as well as potential alternative clinically proven treatment options. So you can see there I've got knee arthroscopy or knee pain, right? Knee pain would lead you to knee arthroscopy. And what you're going to see is a lot of these are musculoskeletal, right? As we all know, there's a lot of stuff in this musculoskeletal or orthopedic category where there's a lot of waste, frankly. These tend to be overprescribed. They don't always have extremely high efficacy. So that's why we've identified these 45. So let's say you had knee pain, you went and talked to your physician, your doctor said, hey, you need a knee arthroscopy. Well, what we're going to show you is, first of all, There's clinically proven alternative treatments you can look at. Things like chiropractic work or physical therapy, maybe an injection. We want you to work with your physician, talk with your doctor about potential alternative treatments, right? These are things you can do. You could actually avoid having surgery, but frankly, drastically lower your costs. So you might say, great, I love the idea that I don't have to have surgery. There's these clinically proven alternative treatments. But I'm here, I might as well research those surgical options as well. What do those look like? Well, what you'd expect from Bind, probably getting it now, is you're going to see different locations and the different prices associated with going to those locations. Now, the thing that makes Bind on demand unique is that for just these 45 procedures, again, uncommon, but for just these 45, you're going to activate or add that coverage through potentially an additional copay, but additional paycheck deductions, right? So it's the idea that a member is actually paying additional premium for additional coverage, right? Why pay for coverage you might never need or want? Why not add it in years you do? You might never need a knee surgery, right? So why are you paying for it in premiums every year? Why not just activate or add that coverage in years you do? Right, so again, this entire, and again, you can add that coverage anytime during the year. You're going to follow sort of the paycheck deduction that's listed there. Now, the whole premise behind this is really to get the member to take an additional pause, right? For just these 45 procedures, to take a pause and say, what kind of options do I have in front of me? Right, what can I look at and find ways to save myself money and ultimately, again, drastically lower costs for their employer or the plan. And this is an example of how that savings is generated, right? So everyone's kind of understanding it now, but to quickly run through it, let's take a look at that MRI, right? So I'm using data, excuse me, I'm using data from here in the Twin Cities. That's where we're located. But this is, again, sort of true relatively for markets across the country. So for an MRI here in the Twin Cities, the total cost can range anywhere from $700 to $2,200, depending on where you go. Now, if we create a bind plan design, and when I say create a bind plan design, we're going to do that with your prospects by taking what they currently have in place, their current plan designs, their cost, a census, so we're going to look at their demographics, and we're going to be able to price a bind plan design that makes sure it's saving money for them as the employer as well as their employees. So we're going to model designs with you. But in this case, we have a sample bind design that shows a range to the member. And you can see what's happening here. The member can save up to $450, right? If they go from the high cost location to the high value location, you can see the difference there. But again, if you look at the range on the far left, there's more money to be between that range, and that the rest of it is saved by the employer or the plan, right? It's really emphasizing the idea that when a member makes a high value decision, the employer or the plan also saves, right? So that range on the left was $1,500. You can see some is retained by the member, some is retained by the employer. Now we do this across a number of categories, right? You can see at the top of the list, excuse me, that there's things like office visits and sample drugs, right? These are common things that happen in healthcare a lot. So you cross the screen and you see, yep, there's savings to be had. Again, it's a little bit smaller, but these are very common. As you go down the table, you see things that are a little less common. Things like maternity, right? Or even that knee surgery we just talked about that is, that is even more uncommon. Well, you look at the savings there, right? A knee surgery in the Twin Cities, depending on where you go, can range anywhere from $8,000 to $48,000, right? It's a huge range depending on where you go. And again, that range being that wide represents waste. Now you go across the screen and you can see, yeah, we can generate thousands of dollars of savings for the member while creating tens of thousands of dollars for the employer or the plan. Again, pretty rare, pretty uncommon, but the savings potential is huge. And this isn't even taking into account those alternative clinically proven treatment options. Right, a member might say, I didn't know I had the opportunity to go do chiropractic work or physical therapy. I'm going to save even greater amounts for myself and ultimately the plan. If I skip ahead a little more here, you know, a common question we get is, well, does it work, right? What kind of behavior change are you seeing? Now, upfront, as we talked about, you know, we're saving 14%, right? So at the highest level, we are generating savings for employers. And we're doing it across these behavior changes that we'd like to see. So, right, if you think about day-to-day things, ER usage is down, brand drug usage is down, but preventive care visits are actually up, right? When you think about how we're using the plan, we can actually use the app to drive people to higher value care. But you still see things like maternity costs are down, pharmacy spend is down, right? We're driving the behaviors we want to see. Even more importantly, though, what about across, you know, surgical procedures, right? We just talked about knee surgery, plannable. What about these things that have a little bit more electability to them, things like that? Well, what you can see here is inpatient and outpatient surgeries are down. The costs are down as well. But ambulatory surgery centers, right, where you can get the most cost-effective care, is actually up, right? The cost is still down, but and even more telling, we're seeing things like chiropractic work, physical therapy, those are way up, right? People are saying, when presented with high value options, I'm going to engage and actually drastically lower costs for everyone. We're getting to the end here. This is just a quick case study I like to throw in. This is Slumberland. They're a furniture retailer located in the Midwest. They have about 1,000 employees. They've offered, and their population is kind of corporate and technology, all the way through sales and warehouse and delivery staff. It's a wide range of employees. They originally offered bind because of their size. They were large enough next to an HSA plan. So they had an HSA, HDHP plan in place. They offered bind next to it. The first summer they offered bind, 68% chose it. Now, this is a little bit higher number than we typically see with bind. It's a little bit of an upward outlier. But we were thrilled to see that in that first open enrollment, so many people were, you know, after hearing about bind one time, 68% chose bind. The next summer that went to 75%, and ultimately this past summer, Slumberland full replaced with bind. They said, we're seeing savings across our members. We want it across all of them. And we're also seeing high satisfaction, right? High net promoter score, high percent of populations that, high percent of individuals that prefer bind to the plan they had prior. And then my favorite part of this slide is the quote on the bottom right. It's the quietest health plan we've ever had, right? So this is Lisa, their total rewards manager, and she's referring to a lack of complaints, right? To satisfaction with the plan. Ultimately, and again, I speak to data and technology a lot, but ultimately this has to, you know, it's a very pragmatic decision, right? We need to lower costs for employers and employees, and we have to create very high satisfaction, right? We have to make a very simple experience, something that members can understand. And then we also need to process claims, right? We need to process them fast. We need to process them accurately. And when people call us, we need to be able to answer their questions, right? We need to make sure that this is a highly efficient plan, and that's what we're delivering. So again, who chooses bind? You're probably all getting it, right? It's companies that are actually saying, yeah, we need greater employee engagement in costly and frankly wasteful healthcare decisions. And they're realizing their deductible plans missed the mark, right? These high deductible plans are not driving the behavior we hoped. It's for HR teams that are saying, hey, I need to hit my budget, but I need to also reduce complaints. And then ultimately, and most importantly, it's for employees or members or patients or just people who need a simpler experience with the opportunity to select high quality, affordable care when they choose to do so. Okay. So I'm gonna jump it back now to Nelson and Rick and Christian, and we can open it up for questions. Or honestly, I would love to also, if you're using the chat window, hear any reactions you have to the plan.
Great, Pat. Thank you very much. There are a few questions out here, so I'll go ahead and read them. And Christian or Pat, I might need your help in answering some of these. But Christian, this one will probably go to you. But the question is, how is bind quoted? What is needed? And can we ask for a bind quote and a UnitedHealthcare fully insured quote, or must we choose one?
Okay. So couple different answers to that. So again, bind right now goes down to 125 enrolled for on a self-funded basis. If we're going to quote self-funded, bind we'd only be able to get a bind quote. And for getting a self-funded quote, what we do ask is for a brief meeting with the client, just because this is a pretty, it's a new concept and it takes a little bit of getting used to, especially if a client were to go with bind on demand and adding in those services. Just something like this morning, a 30-minute conversation, but the group and or yourselves, the brokers, would need to decide which way they want to go based on that conversation with the client. If it is something that they want to pursue, and then we would get the quote. We would get the quote, send it into myself, and then I send it into bind. And so we would just need everything that you would be accustomed to and requesting a self-funded quote, claims experience, high cost claimants, census, renewal, current rates, SBCs, all of that. So on a 51 plus basis for fully insured, yes, we can. Again, we still kind of want to be strategic about this, but we can show a UHC and a bind option. We don't technically kind of want to get in the habit of just kind of shotgunning these things out, just because it is kind of a, I don't want to call it a niche product, but it's, it has its place, right? It might not be for everyone, and it takes some getting used to, but on a fully insured basis, we could show a couple different options. And again, all of those quotes, the requests for quotes, the RFPs, would come to me or Rick.
Great, Christian. Yeah, again, just send it through the Cornerstone team, because we know everything that's needed, and we'll get that over to your appropriate representative.
Correct.
Great. Yep. Great. Next question, which I can handle, says, do all copays go towards the maximum out of pocket? And the answer to that is yes, it does.
Yep, it is a good question, though. Just because when we talk about copays, absolutely, you're right, Nelson. They all go to the out-of-pocket max. But for the on-demand program, if you remember, the on-demand program had those 45 procedures, right? Uncommon, plannable. Those have an additional paycheck deduction, and that paycheck deduction does not apply to the out-of-pocket max. So when we set up the plan with the employer, we still set a cap on those. We want to make sure it's not unlimited, right? But those, like premium today, like you're paying out of your paycheck today, do not apply to your out-of-pocket max. And a big reason we do that is we want to keep skin in the game. Right, if you think about these musculoskeletal procedures, a lot of them have sort of an electability to it, right? And people start to say, when they hit their out-of-pocket max at the end of the year, I'm going to go get that done, right? This is the year I'm getting my elbow done, or I'm getting my knee fixed. And so we keep some skin in the game by having that component of that paycheck deduction.
Great, thank you, Pat. Next question is, bind on demand. Does extra premium to employees fall under mid-year exception for a Section 125?
Yep, so that's exactly right. We have some legal white papers around that. And what I would always say, and I think we all have to say this, right, is it's sort of that legal disclaimer that I clearly don't even know that well. That's, hey, we don't provide tax advice, speak with your lawyer, those kind of things to decide, because an employer can decide if they want to do that pre-tax or post-tax, that mid-year premium. Now, with that said, if I think about the clients we have in place, and again, we have about 50, they span, from pretty small all the way through jumbos. United is a client, Medtronic, Target, Best Buy, they're all clients. They've all run it through their legal teams as well, and they're all doing it pre-tax as well. So we feel very comfortable with that ruling. But yeah, it's a mid-year adjustment, correct?
Okay, and let's see. I apologize, our question's the way it is. It's kind of hard for me to see, but it says, in general, do you see these priced better than level funded plans that are out there, i.e. the All Savers and other level funded programs?
So or Pat, did you want to?
Feel free.
Oh, okay. I was just going to say, yeah, from in terms of pricing on a level funded, yes, yes and no, because the fully insured, I guess, kind of just remains to be seen, just because it hasn't been rolled out yet. We're still kind of working through that, but from the things that we've seen and the discussions that we've had and the information that's been passed down to us, yeah, I mean, that price point, it certainly sounds like it's going to be right there in line or below the All Savers. Now, that's from a fully insured standpoint. And Pat, I don't know if you would speak more to the self-funded basis, where that might fall in.
Yeah, so, from a self-funded basis, again, we're showing 14% savings for our current book of business. So, that's what we would expect when we model designs. I talked about we're going to model specific design for your employer based on what they have today. We usually target between 10 to 15% savings. And that's what we would expect to create. So, I mean, absolutely, there's other levers that mechanisms that are pulled in the market, but that's where we would fall.
Okay, great. Please tell me more detail on the buy-up on bind on demand.
Sure. So again, the on-demand, so remember I talked about bind had two approaches, basic and on-demand. I'm glad to ask that question because I think I forgot to say this. For self-funded, an employer can decide to go basic, which is all copays, no buy-ups, if you will. Everything's a copay, including those 45 procedures. They're included as well. And you're going to get a range of copays to drive the appropriate behavior. So two ways to approach it, basic or on-demand for self-funded. For fully insured, it's going to be only on-demand. So for fully insured clients, it's only on-demand. So you have the buy-ups. And really how it works is, again, if for one of those, if you say, hey, I'd like to have one of those 45 procedures, you're going to be presented with a list of options that say, here's how you can add or activate that coverage. There could be additional copay, an additional paycheck deduction. Again, as was asked, you can do that at any time during the year. And if I remember correctly, the one we showed was $50 over 10 pay periods, $500. It's going to start right then. You're going to pay that schedule. And I'm trying to start to guess at some of the questions, but that schedule can go over a plan year, right? We're just talking about sort of how that's reimbursed. We're going to work with the HR teams to set them up with an employer portal so they can manage those payroll adjustments. Again, remember, these are fairly uncommon. It's just that they generate quite a bit of savings. And then the big question we usually get is, what if somebody leaves, right? What if somebody leaves within those 10 pay periods? Well, remember, they're basically, paying back their employer, right? So if they leave in the middle of that, the employer is on the hook for those. They can't go in one-time lump sum or go grab them all. So let's say in that example I said there were, it was $50 over 10 pay periods. Let's say somebody left after 5 pay periods. They only paid $250 back. Well, the employer is on the hook for that $250. It defaults back to them. But if you think about it, it's not that different than what happens today, right? If somebody went and got a $48,000 surgery at the beginning of their plan year, and then they left the company, they're not paying any premium the rest of the year either, right? They're not paying their annual share of healthcare. They got kind of a good deal on that surgery. So that's worked into the underwriting for current plans, as it's been in the underwriting for bind as well. And ultimately, what we want to do, and this is kind of the most important part, is we want to make sure we're always driving to higher value care, right? So we don't want to see an employer miss out on $250. But if you think about the fact that we might have drove someone from a $48,000 surgery to an $8,000 surgery, save that employer $35,000, right? We always want to drive to higher value care. And again, fairly uncommon that they leave, right? It's a percentage of a percentage, but ultimately always driving to that bigger nugget and higher value care.
And to that point, I guess just kind of as a for Ohio, just as a frame of reference, it's obviously a larger account, but we have Dayton Children's as a client with bind. They have about 4,000 people there, and in their plan year, of those 4,000 people, there were, I think, like 122 of those 45 procedures done throughout the course of the year. So it's such a small percentage. And Pat, I think you might have mentioned earlier, within a general population of a group, only about 5 to 6% of the population are going to utilize those services in general, right? But Bind actually brings that down to 3 to 4%. Just again, through the transparency tools that they show and letting them know that there are some additional options before you just run out and have the procedure done. So again, just for the state of Ohio, just a reference. I know it's a larger account, but again, just illustrating the point that it is just a small percentage of the population that has these done, but now the entire population doesn't have to pay for it with the on-demand feature.
Great. Christian, this one will probably go to you, but what effective date can we start quoting for the 51 plus fully insured?
Moving target right now. The latest that we heard, the wish list was 7/1. We haven't got that approval yet. We're still holding our breath. It could come literally any day. But again, so I would say the target is still 7/1. As we're creeping into May, that may be pushed back into August. So it's literally just a matter of getting the approval and once we do get it, I mean, we'll pretty much be ready to roll. We have to kind of just check a few boxes within underwriting, and then we'll be able to start quoting on it.
Perfect.
So I know it's not a firm answer right now, but that's the intent right now.
Not a problem. I do believe this is our last question, but it says, what is the minimum size employer Bind will quote on?
So yeah, good question. And it's 51 enrolled for fully insured. And then for self-funded, it's 125 enrolled.
Great. Well, I want to thank everyone. I want to thank Pat and Christian for their time today. I want to thank everyone for attending the webinar here. Great stuff. If you have additional questions.
Yeah, Nelson, I was just going to jump in real quick. I'll send you again that broker toolkit that you can blast out. That has just again some really good literature in there, some videos and stuff about Bind, just some refreshers, but just a really good resource for the agents to have at their disposal when they're out there talking to clients or if they have other questions or anything like that.
Fantastic. If you have any additional questions, please feel free to reach out to your Cornerstone contact, and we will work with Bind and UnitedHealthcare, and we're really excited to offer this product. I want to thank everyone for your time today, and have a great morning. Thanks.
Thanks everyone.